You're going to learn if you should have your child's vision checked and why nobody may have mentioned it up to this point. Now, before you dyslexia theorists come burn down my house, I'm not saying dyslexia is a vision problem. I'm not saying all struggling readers have a vision problem. What I'm saying, in my decades of teaching neurodiverse children how to read, I've often found vision problems, particularly a type of vision problem called binocular vision disorder, co-occurring with the dyslexia, auditory processing disorder, or autism. You're also going to learn how to determine if your child may need to have their vision checked, why you should go to an ophthalmologist rather than an optometrist, why you should go late in the day and have them read in the parking lot and read in the waiting room, and why you still may need to go even if their vision has recently checked out as 20/20. Now, let's meet a mom and an incredible child who've gone down this road and gotten amazing results.
So let's talk about that journey where I introduced you the idea that there might be a vision component, and how we went down that, and what did you think when I said that?
hmm
And then you
Um,
had to go to an ophthalmologist. Remember, I wouldn't let you go to an optometrist, and so let's talk about that.
yeah, so Bo had his vision checked as far as his he had 20/20 vision.
2020
But
mental no. Yeah, I gotta say something. Are you listening? He had 2020 vision. But he still had, I'm sorry, because I get so upset because I fight this battle with parents. I'm like, just do what I say because I'm good at this. All right, all right. I'm sorry.
no,
Go
you're
ahead. Go
good.
ahead. I'll be good.
And so you actually noticed in the first meeting with him, you noticed the way he was like squinting and doing things with his eyebrows and turning his head and stuff. And I think that kind of flagged it for you. And yeah, so then we went to see I get the words mixed up, ophthalmologist. They found that he had convergence insufficiency, which is an eye tracking issue. And so it made words blur and double. And so he'd have to fight to focus his eyes, which made reading really fatiguing, the school day really fatiguing. He had no idea that other kids weren't having to do that as well. So it was news to both of us that, he was having to struggle so much on just to be able to see the words and clearly.
And he got the glasses, and now he wears them now just for reading, right? Or just for schoolwork.
He can wear them all the time if he wants, but he mostly wears them for reading or other close work. And the glasses, the way it was described to me was that the glasses remove some of the fatigue or the strain on the eyes, but then he did vision therapy for maybe 5 months. And that worked to fix the tracking issue.
Right.
It's not completely fixed yet, but there's been a lot of improvement, and he's noticed, and we've noticed a shift in how fatiguing.
Absolutely. And I'm not saying that you have to do the vision therapy because I've had a lot of families just get the glasses. And what you talked about convergence, right?
Mhm.
And I've had parents say to me, my kid's like a star based, like why is this, how has this gotten past us? Because that type of vision problem happens up close, right, Ryan? That's what they
Mhm.
explained. And
Yeah.
that would be reading. So it's not like these kids are walking into walls, or they a lot of times they have 20/20 vision, but it's comorbid. It exists with, because Bo has other learning challenges.
Mhm.
And but by finding this one, it allowed us to teach him how to read. Like, it made the journey got, like, when he described, like, pre-glasses, post-glasses, what the working with no fear reading was like. If
Yeah.
you could.
Um, it was really hard in the beginning to work for very long. There was a lot of breaks. There was a lot of, go run a lap around the house and move and trying to get just any, additional minute felt like a celebration. But then, with the glasses and just continuing to stick with it too. And I think him getting more used to your system and stuff. But I think it just allowed us to work harder for longer.
You
And
gotta work harder for longer. The glasses, for a lot of the kids that I work with, they can work harder for longer. And they stop skipping line. Remember Bo was skipping sentences, he was skipping words, and that was after we worked for them for a while.
Mm-hmm.
And I'm like, this, and you know, I could, and you could, like you said, I've been working with children for so long. A lot of times, you know, I don't send every child I work with to the ophthalmologist. I don't recommend that, but there's things that I look for that I talk to parents about, and that's that the eyebrows coming down, right? They're not even, they don't even know the tension around the eyes, but it's only when reading, right? You know, and when Bo would look up and talk to me, eyebrows back up, right? And then skipping whole words and skipping lines, and he doesn't do that at all anymore,
Mm-mm.
which is pretty cool. So, but once again, you know, I buck the system so much with how I work my program. There will be people that will be angry and say, you know, don't give parents hope that it's, you know, I never did present it to you as like a get out of jail free card. But
Yeah.
it did, like, if you think about, and this is going to be hard, I should have warned you. If you think about all the things that you've done with an No Fair Reading program and all the improvement he's made, what percentage do you think the glass has made in this huge jump? He's jumped 3 grade levels in reading comp.
Yeah, it's really hard to know, but it's hard for me to imagine just knowing how it was literally painful for him pre-glasses.
Yes, yes.
Not that he put the glasses on and it wasn't painful, but it just
No,
reduced it enough that we could do the work
that we
to,
could get here.
yeah, he could
Yeah,
do.
that we could get here. And it pains me. I often wonder how many children, neurodiverse children with either dyslexia or auditory processing disorder or autism or any number of things are walking around out there struggling to learn to read, and they may have a small vision problem, but it's undiagnosed. So my
Yeah.
hope is through this video that some parents will go, my child's skipping words, my child's doing all this, and they might mention at school to the literacy expert, I'm going to get his vision check, and that person, I've actually had parents get attacked, like get emails, don't do this, and there's whole reasons for that. That's because people don't want to. There's like a arguments among fiefdoms, like the dyslexia people argue with the APD people, and everybody's arguing. I'm like, look, we need to teach children how to read. But what would you say to a parent that's watching this video and maybe had never even thought about getting their child's vision checked, and their child is skipping words, and their child is skipping whole sentences? What would you say to them about going to ophthalmologist?
Um, I would highly recommend it. I think even if that's not the issue, you've ruled out something that could be, and that alone is really valuable.
Yep.
Then on the off chance that it is an issue, I mean, I was heartbroken when I heard that he was seeing words double and blur and that he just thought that was normal.
Right.
So the idea that, I wish we'd gone sooner and picked it up sooner. So I would say,
Right.
yeah, that's my perspective.
Let's go. Let's get Bo in and say hi to people.
Okay. Hey,
'Cause the
buddy,
kid's amazing.
come on over.
This kid's a genius. All the kids I work with are geniuses. They're all incredibly smart kids with processing challenges. Hey, there he is. Wait, with his glasses. Hey, Bo, how you doing, buddy?
Good.
How do you like your glasses? Did they help you learn to read?
Yeah, I like them
Why do you like them?
because they help me a bunch and they help me read and yeah, I don't know, they just help me.
You may want to consider having your child's vision checked with an ophthalmologist if they're tilting their head, their eyebrows are coming down, they look in pain or uncomfortable while they're attempting to read. If they cry or they literally look at you and say, this hurts, right? That's a clue. You also want to consider it if they're skipping sentences and even whole paragraphs, if they can't orientate themselves on the page, and they do that continuously, like, hey, you skipped that sentence. Let's now look right there now. And then 2 minutes later, they skip it again. That could be an indicator. The eye exam that your pediatrician does will not find any of this. So you need to go to an ophthalmologist. Now, optometrists do check for some of these things, but what I have found is ophthalmologists are medical doctors. They go to 12 years of college. They're more experienced at finding these type of things, and they're better at it. If your insurance company will not cover an ophthalmologist and say you got to go to an optometrist first, look for a pediatric optometrist. Lastly, I told you to, you heard me mention take them late in the day. You want to take them late in the day, not to torture them, right? But you want them to be tired and you want them to read in the parking lot and read in the waiting room, because some of these things can be intermittent. They don't happen all the time. So you want it to happen if anything's happening. And it might be that nothing's happening, which is good, right? And you may go down this road and, there's nothing there. But so often I have found that parents go down this road, just like the video you watched, and there is something there, and glasses make a huge difference for these children. If you want to learn more about how I can teach you to teach your child to read in 15 minutes a day, please check out this video. Please subscribe. I've got a lot more coming out.
Because they help me a bunch, and they help me read, and yeah, I don't know, they just help me.